Let's begin with a simple but powerful idea. Health is not just the absence of disease. It's the ability to live with dignity, make choices, and plan your future. That's the heart of sexual and reproductive health and rights, or SRHR. Globally, SRHR isn't just a health issue, it's a human rights issue. Think of a young woman in rural Nepal who, for the first of time, walks into a clinic and receives contraception without stigma. That moment didn't happen by accident. It's the result of decades of global and regional commitments, from UN conferences to regional health pacts, that say every person deserves control over their body. Today, we'll trace how these commitments evolved, how politics shapes them, and where Africa stands in this story. Let's start with the big picture. So where did this global momentum begin? Imagine the year 1994, in a packed conference hall in Cairo. Delegates from 179 countries are debating population, development, and women's roles. What emerges is the International Conference on Population and Development, ICPD, a turning point. For the first time, the world agrees reproductive health is not just about controlling birth rates. It's about individual rights, dignity, and access. This wasn't just talk. It shifted how governments fund clinics, train nurses, and write laws. But as we'll see, good ideas on paper don't always translate smoothly into practice. Now let's talk politics, because SRHR is deeply political. Every policy, every budget line, every clinic opening or closing reflects power, priorities, and accountability. Take universal health coverage, UHC, for example. A country like Rwanda has made headlines by training community health workers to deliver contraceptives door to door. That's political will in action. But in other places, SRHR gets sidelined. Why? Competing goals. When the Millennium Development Goals, MDGs, prioritize child survival, maternal health got attention, but safe abortion, gender equality, and sexual health, often left out. Cultural pushback. In some countries, religious leaders argue that teaching teens about condoms promotes promiscuity. Funding battles. Donors want measurable results. A vaccination campaign? Easy to count. Comprehensive sexuality education? Harder to fund. But here's the shift. Beijing 1995. The Women's Conference didn't just talk empowerment, it amplified SRHR as a... Fast forward to 2015. The world adopts the Sustainable Development Goals, SDGs, 169 targets, over 300 indicators. Where's SRHR? It's scattered. Goal 3.7, Universal Access to Reproductive Health Services by 2030. Goal 5.6, Ensure Sexual and Reproductive Rights. But here's the catch. SRHR isn't a standalone goal. It's woven into health, gender, and inequality targets. That's progress, but also a risk. When everything is a priority, sometimes nothing is. For example, a country might report 95% of women deliver with a skilled birth attendant. Great. But say nothing about whether those same women can access emergency contraception after assault. And let's be honest, some issues remain politically radioactive. Safe abortion, LGBTQ+ health, adolescent sexuality. These are often sensitive, code for we'll get to it later. So, 20 years after Cairo, how are we doing? The ICPD Beyond 2014 review reaffirmed SRHR as a universal human right. But it also exposed gaps. Laws versus reality. A country might legalize contraception, but if clinics are 50 kilometers away and nurses judge you, what good is the law? Funding competition, climate change, pandemics, conflict, SRHR often loses the budget battle. Cultural legal clashes. In some places, customary law says a girl marries at 14. National law says 18. Guess which one wins in the village? The review called for harmonizing laws, ending violence, and ensuring access to education and services. Easier said than done, but it's a roadmap. Now, let's zoom into Africa. Africa isn't a monolith. 54 countries, thousands of languages, diverse histories. But one thing unites them. Regionalism shapes health policy. Think of SADC, Southern African Development Community. In the early 2000s, countries like Zambia and Botswana realized we can't fight HIV alone. So they created cross-border clinics for truck drivers, harmonized drug policies, and shared data. That's collective action. Or consider the Maputo Plan of Action, 2006. A bold African framework for SRHR. It said, by 2015, every woman should have access to comprehensive reproductive health services. Ambitious? Yes. Fully achieved? Not yet. But it set a regional standard. The African Union, AU, doesn't just talk. It sets continental policy. In 2003, the Continental Policy Framework on SRH and Rights was born. It focused on contraception. Remember, 1 in 4. African women want to avoid pregnancy but lack access. Maternal health. Still too many deaths from preventable causes. Gender equality, because you can't have SRHR without challenging child marriage. But here's the tension. Political will varies. A country like Ethiopia integrates family planning into its national development plan. Others? SRHR is mentioned in speeches, not budgets. How do you hold governments accountable? Enter the APRM. It's like a regional report card. Countries volunteer to be reviewed on governance, including health. For example, when Kenya went through APRM, civil society groups said, "You're doing great on HIV treatment, but what about adolescent SRHR?" That feedback led to new youth-friendly clinics in Nairobi. It's not perfect. Reviews are voluntary, and follow-up is weak. But it's a start. Let's stay with SADC. In 2016, they launched the SRHR strategy, 2019-2030, with a vision, healthy sexual and reproductive life for all. They're tackling HIV, SRHR, and TB integration, because you can't treat one without the others. Youth investment, training peer educators in schools, policy harmonization, so a woman crossing from Zimbabwe to South Africa isn't suddenly denied services. But funding? Still a challenge. Donors love pilots. Sustaining them? Not so much. So where are we? Incremental progress is the story of SRHR, not revolution, but steady, hard-won gains. Alignment. AU and SADC strategies now link SRHR to youth dividends and economic growth. Smart. Social change. In Uganda, a radio drama about a girl refusing child marriage reached 10 million listeners. Norms shift one story at a time. Youth at the center. From Addis to Cape Town, young people are demanding comprehensive sexuality education, and governments are listening. But let's not sugarcoat it. 1 in 3 African girls still marry before 18. 225 million women globally want contraception but can't get it, many in Africa. Safe abortion remains illegal in most African countries, pushing women to backstreets. SRHR isn't just about clinics and condoms. It's about power. Who gets to decide? Who gets access? Who gets heard? As future leaders, researchers, and citizens, you are part of this story.